Hello, I'm Dr. Shammai Rockove from the Center for Men's and Women's Urology in Portland, Oregon, and we're going to respond to some questions that we received this past week. Dr. Rockove, thanks for taking my question. What happens during a male urology exam exactly? I'm supposed to get one. My general doctor told me this, yet I have no idea what to expect. Will it be painful? How much will I be touched down there? I think I'd prefer a male doctor, but I honestly don't know. I have a lot of confusion. I'm going in for a bit of painful urination and occasional spots of blood too. So that's an interesting question, and I will not necessarily take those in the order they were asked, but we'll address things that we see commonly, which is, do you need to see a man or do you need to see a woman? And the answer to that is whatever you're most comfortable with. In our practice, we have men and women physicians and physician extenders, and some women like to see male physicians, some men like to see women's physicians, and the answer is it's about your health, so whatever you're comfortable with. In terms of the other question, what a male exam is, I would assume that what your primary doctor is discussing is the area under your waist. So it's an exam that evaluates the genital area, the scrotal area, and depending on your age, a rectal exam to examine your prostate. It does require touching. I mean, there's no way of examining these private areas without truly touching, looking, and examining. There are abnormalities that you can only identify by the way things look. There are abnormalities that you can only identify by abnormal tactile feedback. And being a man who's gone through this, I don't like it, but I'm not given a choice. We look for things because we think that if we find them, we can identify issues that if we address them, we can help you in the long run, extend your life, make your life comfortable. So the price that we sometimes have to pay, all of us, is to go through what is not ideal or comfortable examinations. The one thing that you should expect from your physician is that it's done respectfully, carefully, and with an understanding of how it's making you feel. If you get the sense that what they're doing, they're being cold, uncaring, I would ask for the exam to be stopped. But if you recognize that you're being examined by someone who is doing it with the great care necessary and with your best interests in mind, as long as you can physically tolerate it, it needs to be done. Now, the other issue, which I've had other videos on, but I want to briefly mention, is the blood in the urine. And I think I can't say this often enough. It is never normal to see blood in the urine, never. It's not always because of something dangerous going on, but something's going on. And you need to have that evaluated, and that's best done by a urologist. The male exam can be done by a very competent, experienced primary care physician if they're comfortable doing that. Certainly if you go to a urologist, you could be sure that they know how to do the exam, but only a urologist can do all the appropriate tests necessary for seeing the blood in the urine. I would encourage you to do that if that's happening. Thank you for that question. I hope that helps you. Thank you, everybody, for watching this video. Please give us feedback if you can. Until the next time, have a good week and a good weekend.